2, 1. We're in business. All right. Okay. Well, good afternoon. This is the Aspergillosis Trust with another video we're doing for you. And today I have Ras, who's a dietitian. Do you want to introduce yourself a little bit more, please?
Yeah, hi everyone. My name is Raz and I'm a respiratory dietitian and I work at the Royal Brompton Hospital. So I specialise in respiratory medicine, all different types of diseases, including Aspergillosis.
And it's really interesting. I didn't even know there was a respiratory dietitian, but yeah, there you go. What are like common challenges that you see? Because you work like Brompton sees a lot of people with Aspergillosis and related disease. What do you see a lot?
Yeah, so the main role of a dietitian in respiratory and the main types of nutritional problems that I see personally is actually what we call malnutrition. And I know that word is quite stigmatized, and typically when I use the word malnutrition, people have a certain image in mind, but it's a lot more common than we actually realize. So about a third of people who come into hospital are malnourished, and going into that a bit more about what it actually means is the patients I tend to see are people who've lost weight unintentionally, and the reason for that is because that's linked with poorer outcomes, and people tend to lose their muscle as well, especially if they've got a respiratory condition. It also might mean if they've got a low BMI, which is called body mass index, which is your weight against your height. And also I see patients who have very minimal intakes for about 5 days or more, and that's because of their risk of losing weight or getting a low BMI. So those are kind of the main issues within respiratory dietetics that I tend to see.
Do you see the people at the other end of the scale as well? Do you see people that possibly due to medication or other reasons are actually have a higher weight than you think would be recommended?
Typically we do a little bit. So there are different categories in body mass index, BMI. It's quite a blunt tool. It's not the best,
yes.
As lots of people might know. Muscle weighs more than fat and lots of different complications. So we do a little bit, but there are different services depending on where you're at, and sometimes if that's the most important issue, that will go to a different service with different tiers. Also, just on that point, so with the different tiers within body mass index, so there's underweight, kind of normal weight, overweight, and obese. There is some evidence, not specifically within Aspergillosis, but for example within COPD, which is unfortunately where it's great, but where most of the research is, so we tend to draw from, that being overweight can be a little bit protective. And I don't mean obese, I mean kind of being a little bit bigger. It seems to be associated with a better FEV1, so the breathing technique. So we would also err on the side of caution with weight management. And the reason for that is because we want to make sure when you lose weight, and that's fine if you want to just contact your healthcare professional, we want to make sure you're maintaining your muscle, because you've got muscle around your lungs, you've got muscle around your diaphragm, which all helps your breathing. And the worry is that if you lose weight really quickly, that you'll also lose your muscle. And so when patients want to lose weight, that's absolutely fine. But I would just, if you do have a respiratory condition, I would just be very cautious, because we don't want you to get weaker.
Okay, but as you say, that's like somewhat overweight, you don't necessarily worry, but obesity can be linked to finding it hard to keep fit. So that's a different problem, right?
Yes, finding it hard to keep fit. And the worry is that if you've got excess fat kind of pushing down on your lungs, it can restrict your breathing, and also increases your risk of other things like cardiovascular disease, heart disease, type 2 diabetes, etc. as well.
Yeah. And so in that case, you will recommend weight management.
Yes, weight management, but cautiously done.
Okay. Okay, that's interesting. So if you're saying, because I didn't really know that so people with relatively low BMI, and I know what you're saying, that low BMI is far from precise, and it depends on your background as well, and many other things, and people who are very going to the gym all the time may have a higher BMI, but actually be very. But anyway, if you have people where you think they have, let's call it unintentional low BMI, what strategies would you normally recommend to them?
Yeah, so we'd go through an individual dietary approach. And I think typically when people have lost weight or they've got a low BMI, there's a couple of things going on. Sometimes I think it's really important to say that it can be the disease process itself within respiratory medicine. So it's not quite set in stone what we think exactly is going on, but there is a hypothesis that, for example, when you get an exacerbation or an infection, you're not feeling well, what is happening is they hypothesize that inflammation is being sent around your body, and that's dampening down your appetite signals. So when you've got a poor appetite because you're not feeling well, that's not actually that's not intentional. That's because there might be inflammation in your body dampening it down. So typically during that time as well, what is also happening is that your breathing, it's more difficult to breathe. So what we call your work of breathing is higher, which is burning more energy. And also because your body's trying to fight off the infection, it's also burning more energy, or what we call calories. So it can be a little bit of an unfortunate cycle. Your appetite has gone down, but you need more energy than ever. And so you're probably eating less, is a lot of what we get told. And because your body needs more energy, what it will do is it will find energy within your body in other ways. So it will go to your fat and your muscle stores and begin to break them down in order for it to fight off this infection, in order for it to get energy. So it can be a really big vicious cycle. It can be really hard to break. So there's kind of that disease process sometimes going on. On top of that, that is linked in with additional symptoms which can affect your nutrition. So poor appetite in itself is a symptom. We think about your increased work of breathing, so you might be more short of breath. And the reason that's really important is because it can be really hard when you're short of breath to eat, to coordinate your breathing, your swallowing whilst trying to breathe. We know that people get put on different medications. Some people might get antibiotics that can cause diarrhea. Some people get constipation, and again, that will impact your intake. People might be using different forms of oxygen, again, face masks, so it can impact how much you can eat. So there are lots of different symptoms in the way that we would try and look at even before we start giving dietary advice. But once kind of you identify some of them, so if this is sounding familiar, it's really good to identify some of them and speak to your healthcare professional about it. And then what we'd look at is optimizing two main nutrients, and that's energy and protein. And that's because, as mentioned, your muscles might be wasting away through the disease process. So protein is the building blocks to your muscle. So we want to make sure it's optimized, as long as you don't have any other comorbidities which might be affecting that. So for example, if people have renal disease, they have specialist diets, and that wouldn't be appropriate advice. So we'd look at that through an individualized approach, looking at what you're kind of managing in a day. We often recommend, you might hear the little and often pattern, and that's just because it might be easier, especially if you're short of breath, to get little bits but frequently in you. We often recommend what we call food fortification. So that's looking at what you're eating, because it can be really overfacing to say eat more, especially when you don't have an appetite. So it's looking at what you're eating and looking at how it can be made more energy dense, or having a little bit more protein in without increasing the portion size. So if you're having, I don't know, porridge, for example, it's whether you can add a little bit of extra cream, a little bit of extra sugar on top. And that just makes it more energy dense without increasing the portion size. And typically now we're also looking at protein options and fat options, which are better for the heart as well. And then typically, if again that isn't working, we would look at nutritional supplement drinks. So you'd look at that with your healthcare providers, and these are typically milk or juice based drinks, and they can provide extra energy and protein, and they'll be prescribed for you by a dietitian or through your GP. And a lot of people just find that it's easy to get down, and it has vitamins and minerals as well. And then sometimes, and I think very few people come to this, but it's important to mention, if this is happening on a really long-term basis and we're really struggling to get people's weight up, on occasions we will look at alternative routes of feeding. So that includes not eating orally but through tubes. So could be just for a short time if you're in hospital and you're not feeling well. So that could be what we call a nasogastric tube, which goes in your nose and into your tummy, or a longer term tube which goes directly into your tummy. That's very rare from what I've seen, but it definitely does happen. So just important for some people to be aware of.
You firstly, what you said about have a crisis and health and weight is That I can confirm. I also noticed that I'm unwell for 2 weeks or something like that. My weight will have gone down. And I didn't realize that that was a well understood pattern. So thank you for that. Is there some people tell me that there's a clear relation between weight and medication. Is that known, or is that a myth, or have you got experience with that?
So I think definitely, that the main thing with kind of medications, so I mean, there are in some drugs, for example, I know we're not covering here, but like interstitial lung disease, some medications have been shown to kind of drive down weight a little bit. Generally speaking, what they tend to do is they tend to cause these nutrition impact symptoms. So they tend to cause diarrhea or a poor appetite. And then that in turn is kind of the side effects of the medication, which tend to impact nutrition as opposed to it directly reducing weight.
Okay, that's fabulous. I think what you're saying is that it sounds very much that you think it's while you can give generic advice, it's better to have a one-to-one discussion and look at all the facts, because it seems there's so many variables that yes, we want people to have, bluntly call it a BMI that's whatever, but how to get there is very different from person to person. So I actually wanted to ask you a little bit about dietary restrictions, because that's mentioned as well. Firstly, alcohol, itraconazole, which many of us take if it's available, has significant liver impact. Is that like a big no, or is it a bit more nuanced than that?
I don't actually know.
Okay, it's fine.
Cut that bit out.
It's fine. Yeah. I've been taking it for 15. Yeah, no, I took it for 15 years, and the first 10 years, whatever, I don't care. And now I don't drink alcohol anymore. So that's fine. Don't worry. And then what's your take on restrictive diets? Vegetarian, veganism, or on the other side, keto. Do you encounter them? Are they problematic, or?
So we would never tell anyone to restrict their diet on like a specific diet, especially if they're struggling with their nutrition. I think it is important to take into consideration people's cultural preferences, kind of ethical preferences, and also kind of what they like to eat and things. So I would work with everyone to see kind of what individually we can do to improve that. I would say the most important thing within respiratory, kind of generally speaking, is, sadly, it's kind of no special, but it's kind of a healthy, balanced diet. And also, if you have no other past medical history or comorbidities which change your diet, it's also just making sure you're having, I would say, a protein source at every single meal, because I really think that that's really important to keep your muscles intact and there to keep you strong, and just really important to make sure you have enough. I'm not saying a crazy amount. I'm literally saying, making sure you're having a source at every meal. So that includes meat, fish, eggs, vegetarian sources like corn or soya, or lentils or beans. So a whole load of different varieties. So different diets are absolutely fine. It's just how you incorporate the different types of foods into your diet.
That's perfect. I'm vegan, right? I didn't want to tell you, but you passed the exam. That's kind of all the questions I had for you. And I'd like to thank you for our view. It was really interesting, actually. I really learned a lot in a pretty short discussion. So thank you very much for that. And I think the key takeaway that I have is if you struggle with your weight or dietary questions, please get in touch with a dietitian, ideally somebody who is specialized in respiratory problems. All right?
Yeah, definitely. And I'll link you some resources that you can put hopefully in the chat as well, which might be helpful, including kind of the vegan Eat Well guide. So you've got a load of different.
Perfect. So I'll put this on YouTube, and then we can put it in the comments there.
Yeah, that sounds good.
Thank you very much.
Thank you.